Yes, hello everyone. My name's Cathy Lyon, and I am I was a nurse for many years, and now I work as an End of Life Doula, which is a guide to people who are coming to end of life or needing support, or families who need support with that. I'm also a member of the Executive Council for the Huntington Disease Association, which I joined. I became a member of the council in 2018 after I retired from my role as registered manager at Stanley House. So I'm very familiar with Huntington's disease and the Huntington's Disease Association. So I'll crack on, and then we can have I'll answer some of your questions afterwards, okay? So we're all on the same trajectory. There's no matter how we're going to get there, we're going to all end our lives. Some of us might live to a ripe old age. Some of us may suffer an accident. Some of us might develop a life-limiting illness. But we're all going to reach the same point eventually. This is the inevitability of life. Given that this is the one thing that we are certain of in this uncertain situation, it's surprising then that we spend so little time contemplating it or talking about it. When we're expecting a baby, we plan and we get excited and we research what's going to happen, and we wonder what's going to be like, and where will we have that baby, and will we have music when we're going to have our baby, and who will we like to be there, and we're going to have medication, and we spend this whole 9 months planning this situation, and yet with our end of life, we tend to not think about it and not talk about it until the very last minute. We think if we don't talk about it, then it's not going to happen. Is that what you're thinking? Or we think if we do talk about it, then it might happen sooner. Is that what you think too? Or if we think if we talk about it with the people who are dying, that they're going to get upset, or we're going to get upset. So then it's all just easier to not talk about it at all. Thanks, Ruth and Kath, for inviting me to do this webinar, because it's an essential topic that none of us should avoid. I've supported individuals with Huntington's disease and their families for over 20 years, and I've been by the side of many who've reached the end of their life. We know what's coming. The thought of it is sad and scary. What I hope to do today is explain to you the trajectory of the disease and illness in general, the dying process, and some ways in which you might be able to gain a bit of control in that situation and reduce the impact of grief for those of us that are left behind. Obviously, we've got COVID situation going on at the moment, and so what I'm going to be explaining is about a different life that we've got at the moment. I'm going to be talking about being by the side of people, and maybe there's an opportunity later on to talk a bit more about COVID and how we deal with that, these extraordinary circumstances. But for now, I'm going to stick with in a normal situation. It is going to be tough, so Ruth advised me to advise you to maybe get yourself some tissues and maybe a glass of water. I will pause between difficult subjects to give you a chance to gather yourselves if you need that. Okay, I'm going to share my screen now in the presentation. So just give me a moment. This is all a bit clunky, which is frustrating, but there you have it. I need to get into there from the beginning. Okay, so this is about coping with loss, and what I'm hoping to give you is some skills in which to do that. Okay, we're all on a trajectory, as I've said, and what the course content is going to be explaining the trajectory of the illness, dying and what dying looks like, and the vigil, which I'll explain later, advanced care planning, loss, bereavement, grief and mourning, and explain a little bit more about them, and a little bit about resilience at the end, which is the way in which we can give ourselves strength to cope with the situation that we're facing. So in my nursing setting, we monitor individuals using certain codes: stable, unstable, deteriorating and dying. And they're four very familiar codes that we would use to help us understand how somebody is in their health path. So stable is what's normal for you. It's when you're in general good health, you have a good weight, your skin is good, and your teeth are good, and your hair's looking good, and everyone, you know, we're all happy with the way we're looking. And we have fairly predictable levels of accidents or incidents, and we don't need to see the GP very often, other than perhaps for a routine condition review. But on the whole, we're feeling good, and we're in a good state of affairs. Now, we would monitor, in a nursing setting, we would monitor that every so often, weekly or monthly, sometimes daily. And if we saw a change in some or any of those areas, we would start to think that maybe things were becoming unstable. And this would mean, you know, when you're feeling generally run down in normal life, we would perhaps see a bit of weight loss, or we would see some skin changes. Maybe the skin would become dry or sensitive, or perhaps developing a pressure sore. We would see some increased numbers of incidents or accidents. Over a 3-month period, generally, we would be monitoring these kind of things, and we would need to see the GP more often. And it could just be for medication review. Perhaps we're becoming more anxious or more depressed, or as well as maybe needing something for to treat an infection or a different medical condition. And we can do things to make you stable again. So we could perhaps implement some strategies to improve your weight, give you some supplements, or medications to treat infections, or we could improve the quality of your skin with certain creams or treatments and stabilize things again. And maybe even with weight loss, perhaps we would talk about a PEG, that's a percutaneous endoscopic gastrostomy, a feeding tube. And I'll talk a little bit about PEGs later, because I know that that's something that people want to talk about. And sometimes indeed with Huntington's disease, people might accept assistance with mobilizing, and then you wouldn't see so many falls or so many accidents. So in that stage, when we're losing weight and we're falling and we're getting some infections, we would be unstable. But we can do things to stabilize that. In HD, as with other conditions too, we can flop around in stable and unstable for quite a long time, and we can plateau and we can become unstable again. We can plateau and stabilize, and we can become unstable again. Again, we would keep on monitoring this and keep on observing what's going on. And over a 3-month period, we would be hoping to see a stable or a plateau. But if we weren't able to get that, and we were still seeing changes and still seeing things going down the trajectory, we would consider that someone was perhaps deteriorating. And that is where we can't get them to maintain weight, no matter what it is that we're trying to do. They're getting repeated chest infections or other infections. Urinary tract infections is another one, or earache or toothache, other types of infections which would show a lessening of our immunity. Or we were perhaps spending more time in bed, they were losing strength, sleeping a lot more. Now again, we could consider maybe antibiotics or medication review or supplements to increase the diet, or perhaps a PEG, we could talk about that again, and we might stabilize them again. But this time, the stability might only last for a few weeks or maybe even a few days. And then you would see another infection or more weight loss. And here we would consider ourselves to be firefighting. You're feeling like it's a constant battle with the doctor, ringing the doctor, getting a nurse to see them. We're not gaining ground again. We're not rising to the former stable situation that we were once in. This is where the burden of illness is overwhelming us. So our immune system is fighting because we can't maintain weight, because we can't get enough food in. We're getting repeated infections because we can't get our bodies in order. We're sleeping all the time because we have an infection, and we're not eating because we're sleeping. And it's called a burden of illness, where the circumstances overwhelm us. So if we were then seeing someone who was sleeping more than they were awake, and the antibiotics weren't working, and we would perhaps, have had 4 lots of antibiotics in the last 5 or 6 weeks, and we kept on, but it was just not getting anywhere. And they had no interest in food or drink, and they were sleeping all the time, and the burden of illness was overwhelming us, then at this point we would be saying or thinking that they were dying. Now, when someone is dying, the dying phase is a very small phase, so deteriorating is a longer one that we would see for a longer period of time. So the dying phase really is only days to live, or maybe weeks, and at that point you're going to be having treatments that are palliative. So palliative is where we're not trying to cure anything. We're not trying to make anything better anymore. We are going to just treat the uncomfortable symptoms that you might be experiencing, or the person you're looking after might be experiencing. I mean, perhaps that would mean a syringe driver. And a syringe driver is a method of delivering medications in a cocktail over a 24-hour period. And it's a kinder way of receiving medication, because you're not having to wake up to get that next pill every 4 hours or so. You're not having to wake up to experiencing some discomfort to get your next medication to make you feel better. And in the syringe driver, you're going to have a cocktail of medication to treat pain, and that can be physical and it can be emotional. At this point, pain is pain, and we're not going to make a decision on what the cause is. We're just going to give you something, and you might see morphine in a syringe driver. That would certainly be the one that they would normally use. And something for anxiety, like midazolam or lorazepam, something like that. And then something to dry up the chest secretions, because they can become a challenge and make a lot of noise, which can be distressing for you, for us that are with them to hear, or for the person to struggle with. And this is a time to get everyone together. And now in COVID, of course, we can't get together, but there are ways that you can get together to tell everybody what's going on, and make sure that everyone's informed. Quickly going back to the driver, I will say with Huntington's disease, sometimes the syringe driver, what they'll put into the syringe driver the first time may not be enough, because people with HD have had a lot of medications already been on quite a lot. So you need to perhaps discuss that with the doctor or the nurse that's going to put one up, just to make sure they're aware of the level of medication that someone has already been on. And people are often fearful of a syringe driver and thinking that putting the syringe driver up will make them die quicker, but they're going to die with or without the driver, and the driver is going to give them a lot of peace and comfort. Okay. So I'm going to talk about the dying process now. So if anyone wants to have a drink or get some tissues ready, I'll give you a moment to gather yourselves together, and I'm going to have a drink too. Okay. So here we have, we're now coming into the dying and the vigil. And a vigil is when we're staying awake to guard something precious. You're going to be watching over someone who is dying, so that they're going to pass from this life safely into another realm, if that's how you want to look at it. And what you're going to see is someone is sleeping all the time, that they're barely rousable. There's going to be periods of restlessness, and this is called terminal agitation. It's something that you see quite often, and it can be upsetting, because it looks like perhaps they're reaching out, or that they're trying to sit up, or they're trying to get out of bed. But be reassured, it's just the brain and the body and the system settling into the situation that's going on, and this will pass and they will settle. There will be a calmness and a euphoria about the person. The body does a wonderful thing when they're dying, and it releases chemicals, very much like the endorphins you get out, when you've done something exciting. It makes you feel really calm and really relaxed, and it's a wonderful thing. And so the person that's dying feels calm and a sense of euphoria. You're going to see a blue tinge to the fingers and toes and lips. As the circulation is receding to the core of the body to keep the core organs working, because it's aware now that the rest of the body isn't requiring this blood supply. So the circulation recedes to the core, and you see this blue tinge to the fingers and toes and lips. You're going to feel cooler to the touch, because the blood has receded. And the warm blood has gone to the core. It's going to be a change in breathing. It could be more rapid, more laboured, which is sort of mechanical, and it's a laboured breathing rather than a normal natural breathing. And you're going to see chain stroke breaths, and these are where they may breathe for 3 short breaths, and then 1 big deep breath, and then not breathe for a little while, and then they'll breathe again. And it's a period of time that, again, where the brain and the body and all the symptoms are settling down into what's happening to it, and that's called chain stroke breathing. And they're going to appear lifeless. There's going to be no facial expression. There's going to be no twitching. The face is relaxed. the cheeks become sunken, and this is because all the muscles of the body and the nerves are starting to relax and no longer work. All the muscles of the body are going to start relaxing, and you're going to maybe hear some gas or a moan, but certainly they will pass gas and you're going to hear that. What you're going to feel at this time is uncontrollable emotions. Sadness and tears are going to come, and you're going to let them come. Don't fight them off and don't worry about it. My mum died, my sister and I cried and cried and cried, looked at each other and cried some more. Let them come because you need to have them. There's going to be some anger, and definitely anger, and definitely frustration at why is this happening, what this shouldn't be happening. There's going to be some laughter with family and friends when people that come into the room, and that's okay because there's a whirlpool of emotions going on at the moment, and laughter is a little moment of peace, and just let it be there and have that little moment of rest in amongst all the other uncontrollable emotions that you're going to have. So don't feel bad about laughing, and don't feel bad about feeling okay in the middle of it all. There's going to be some confusion and desperation and conflict of emotions because you're desperately wanting this not to be happening, and you're desperately wanting them to say, do you know what, I feel better now, I'm okay. But also you're going to want this to end, and you're going to want them to be at peace, and there's this huge conflict of emotions whilst all this is going on, and that's okay. I have been speaking to 2 people recently, and one person said, oh, I just felt numb, didn't feel anything at all, is that bad? And another friend said, oh, I was fascinated. It was fascinating to watch everyone and what was going on, and to see everything changing and to watch them change. Is that bad? And both are no. You know, both are normal. Both is okay. Everyone's going to feel differently about it. There's going to be you're going to get an acceptance of what's going on, and you're going to go with the flow. Other people may accept the situation at different times to you, and don't worry about that, and don't feel awkward about that or judgmental. Everyone's going to feel differently. And you're going to feel fatigued, and you're going to feel exhausted, and you're going to feel like you've hit a wall. And when you do, you're going to feel resentment. I've been here for 12 hours. Why am I still here? What's going on? You know, it's going to be hard, and you're going to be tired, and you're going to feel bad about that. But don't feel bad about that, because this is all just the emotions are being tipped out, and you're going to feel them all. And all of this is normal, and all of it is okay. What you can do at a vigil now, you know, again, because we don't talk about it, we don't really know what to expect, but there are lots of things that you can do at a vigil actually. And so knowing that you're going to have to be by the side of somebody when they die can help you to prepare for that. So one of the things is to prepare yourself, this is going to happen, and accept it as a blessed responsibility that you're going to be by this person that you love. And be there with them when they go through this time in their life. It's as important as a birth. It's the definitive part of their life. So hold their hand and kiss it and stroke it and be tender. Be as tender as you want to be, and let them hear your voice. Read to them poetry or a book or the sports pages of the newspaper. Whatever you think is going to make them feel calm, you do that, because hearing your voice is lovely and reassuring. Music, a playlist, and maybe in earlier happier times you talked about it, and I'm going to get onto that later, and you could put a playlist together like you would do for a birth. What kind of music would you like in the room with you when this is going on? Or something calming. There are lots of lovely things out there for calming periods of time. Fragrances, what makes you feel happy and what makes them feel happy, and there's lots of ways that you can bring fragrances into the room. This is about making this experience as calm and as positive as you can make it for them, but importantly for you too. And rituals. There are lots of rituals if you follow an organised faith, or if you don't. There are lots of things. A funeral is a ritual. It's a way we all come together to share our feelings, and it's something that we do in a certain way. Certainly the Catholic faith, they have last rites, and Islam have certain ceremonies that they do during the vigil. Same with Judaism. There were certain things that happen at a certain time, and having those rituals in life is reassuring to people who are dying, because they know what's going to happen, or they can imagine what's going to happen, but also for you because you know what to do and how to act and how to be. Vigils enhance the quality of life. at the end of life, by supporting those people that are dying and those that are living. It gives you permission to grieve now. This is what's going to happen now. And rituals help the living create continuing bonds with the person that's dying, helping them to cope with, giving them coping skills by increasing their feelings of control and their feelings of purpose at this time, helping them to find meaning in it all. This is from Cecily Saunders, who's the founder of the hospice movement. So how someone dies remains in the memory of those who live on. So talking to someone about how they would like to die, preparing a little ritual that they might like to hear, or that you might like to do, can be really powerful for you and us as how we grieve moving forward. Here's a little page that I've just downloaded, and I put the details of this at the end. Just a little bit about creating a spiritual presence for end of life. And spirituality isn't about being affiliated to a faith or an organised religion. It's about what you find meaningful and how you make sense of life. I'll go on to spirituality a bit later. So here are some things that you can do. But again, I have pinned this to the end of my presentation. And rituals are about letting go, helping the dying person detach and move on into death, assisting with goodbyes, both physical and emotional, and assuring to them that life concerns and loved ones will be cared for. And that's really important. And I know for some of you watching this, it's going to be hard because the people that maybe you're going to be with aren't going to be able to communicate this to you. So which is why talking and finding ways to do this beforehand is really important. For example, letting go and doing a confession in a way, letting someone explain things they wish to unburden. They could be encouraged to write a letter about this, perhaps that you could open at this time, years before if necessary, or whatever time period you have. Things that they wish they'd done or wish they'd said. It's an important time for everyone to resolve their issues. It's an opportunity to diffuse anger and fear, recalling happy memories, experiences of love, helping the person find an eternal place of love and safety, and it's an opportunity to sort of reconcile. Okay, but this will be at the end. A body blessing. This is a lovely thing to do if you don't have if you don't follow an organised belief and you have no plan offered to you, then you can make your own body blessing. And when I did my doula training, we were encouraged to create rituals and write our own body blessing. So this is mine, just as an example, the one I wrote for myself. Bless this beautiful head, a vessel for my mind, for my fabulous brain that held so many thoughts and beautiful memories of my life. My loves, my achievements and my regrets. The joy at the birth of my children and my sadness at the loss of my family and friends. My brain that generated ideas that led me to succeed in so many areas of my life, that gave me knowledge and choice to have the most wonderful life that I could wish to create. Bless these beautiful eyes, for they have seen so much wonderful images of love, viewing the world through the eyes of a child, loving my parents and my family, seeing my mum as the most beautiful woman in the world, seeing the challenges of life through the viewfinder of nursing, and the joys with the filter of motherhood, and the places and landscapes I've seen since I first saw Simon. Bless this beautiful mouth and my voice and the confidence I had in how I used it, singing joyfully with my family and my wonderful sister, the joy of choir and the divine sound of voices together, the whispered words of love and tender, passionate kisses. Bless my beautiful heart, for it has served me well, guiding me through life's challenges, a fulcrum to the push and pull of my life's decisions. It has swelled with pride and throbbed with pain, but neither would I relinquish. When ego and pride tried to grasp at its ardour, it remained firm and true. Bless its capacity to love throughout my life, my first loves, my mum and dad and my sister, and how it grew around my children, so that they lay safely held, eternally protected. The unconditional warmth I found with Simon and the room it made for Sam and Alex and all those that came with him. I rejoice in my friends, Alison and Rachel and Tina and Jake, feeling blessed to have known them all, and the loves I have known in my life, for they brought a richness and pleasure that can never be regretted. And I'm thankful for the love I have felt and the love that I have sought to be kind always. Blessed his beautiful belly and all the organs within, and the meals I've enjoyed cooking and eating, and all the delights of rich and full life that I've tested and tasted. Bless my amazing womb and the miracles it created, my most precious treasures, Jessica and Finley, for whom all it was worth. Bless these beautiful feet, for they have carried me through it all, danced and ran and kept on keeping on to all the destinations of my life. My first day at school and shuffling self-consciously at the Saturday dance, in flip-flops on the pedals of motorbikes around the summer country lanes, to Malta, joyful, familiar sand between my toes. These feet have supported me through long nursing shifts and stood me proud at my mother's funeral, and tripped with delight to my wedding. They've ached at Zumba and yoga and on dog walks and mighty hikes, and held me firm on the deck of boats, keeping me sure-footed as I stepped onto the quays of some foreign clime. And the daily delight of putting on my slippers, for then they knew their work was done, toil over, time to rest. Bless my wonderful body and the wonder of life well lived. Its work is now done, toil over, time to rest. We'll have a moment. Right, advanced care planning, we're on to that. So research has found that advanced care planning discussions improve quality of life and the likelihood that healthcare issues will be fulfilled. The family members benefit by feeling less distressed about their decisions that they've made on their person's behalf, and leading to a greater peace of mind. Advanced care planning is about hoping for the best and planning for the worst. There are lots of different websites that you can look at for advanced care planning, and I've just pinged this one up. This is a Scottish one. Because what advanced care planning is not, it's not about thinking entirely about death. It's about what does living well mean to you, and what does give your life purpose, and what does each day, what does it make and be meaningful? Think about those things and discuss them with your loved ones, and put your wishes into a plan and review your preferences. It's really, really important that you do that. And again, I'll explore it a little bit more in a moment. This currently is out at the moment. This is what's being used in most places of the country, and I think where you are locally. So if you're looking after somebody with a terminal illness, then it's something worth getting from the doctor, especially with the COVID situation going on at the moment. This is a recommended summary plan for emergency care and treatment, and it's called a respect document. And I'm working with a lady at the moment who has a terminal lung disease, and she is living alone. She's dying and is also bereaved, so she's alone now. And she was worried about going in, if she developed COVID, about going into hospital, because having lost her husband to a lung disease, and she has a similar condition, she didn't want to be mechanically ventilated. It frightened her, and she didn't want it anyway. But she would accept high pressure oxygen masks. So she wanted to make sure that they knew that, because if she collapsed at home, she has no one to tell that to. So we did the form together, and she feels much better in herself now for having that. And she got it in a little bag, and just in case she falls ill, hopefully, she won't. But she's taken that control and she's made those decisions. And it's a really good, powerful thing for her to have done. Advanced care planning is for everybody. It's not just for people with HD or people with terminal illness. It's important for everyone. When I was doing the doula course, I was staying in a hotel, and there was a load of big butch biker chaps, and they were all on a security course. And they were, eventually we got talking in the bar, and what was I doing? And I told them, and we got on to advanced care planning. And of course, they said, oh, well, we don't need to talk about that, and I said, well, you all look like you ride motorbikes and you're in security. And I certainly can think of 10 people that I've nursed in my working life who have had life-changing accidents through certainly my motorbikes and in security work. So, really you should get those things written down. And then I asked one of them, are they married? And one was getting divorced. The point is, I said, if you were to have an accident, it's your wife who is your next of kin, and she will make those decisions. So who is making your decisions for you? Do you want those persons making those decisions on your behalf? Take a minute of your life today to contemplate its end. Who is around you now, and who would you like to be there? And how would we know if we haven't got these things written down? I want to read to you an email that Ruth shared with me. And this is about pegs, and we'll talk about that in a minute. That's feed tubes. Okay, so I'll just read this. My wife and I were both having a good time together, and we decided it would be good to continue and that getting a peg feed would be positive for our time together. She was absolutely adamant that she did not want to go past the point where her quality of life was too low. She repeatedly insisted that I must draw the line when the point came, and I repeatedly vowed to do this. And she very much knew that she could trust me. And we didn't write a living will. My plan was to stop the feed when the time came, and I believed I could do this in my own house and that any humane doctor would consent. But the law said otherwise. It was impossible to stop her feed. We were not warned of this before the peg was fitted, and she went on for 7 years longer than she would ever have wanted. And I think that's really important to share. And, you know, I'm not going to give any advice on pegs, except to do your research and understand what it means. Some of the most appropriate deaths that I've been involved in, of where pegs haven't been involved at all with Huntington's disease, where we've been able to modify their diet, which you can modify it and make it safe for them to swallow for as long as possible. So it gave them the pleasure of eating and the pleasure of taste and texture for as long as possible. And then they deteriorated. They went into it where they had chest infections, but that deterioration was a very short period of time, and then they died very appropriately. And it was a very lovely and appropriately planned, staged experience. I've also known lots of people that have pegs, and they live happily with the pegs, and they have the situation that they have. The question I would say is, will peg give you life, or will it give you time? And they're very different things depending on what you're going to do with that time, or what you can do with that time. A quick touch on other things that might concern you for advanced care planning is place of care. Now, in that email there, that gentleman said his wife made him promise to take the peg out. And are people making you promise not to, make them move out of home or live in a nursing home, or don't let so-and-so look after me? Are they asking you to make promises like that? And are you promising that? Because we all know that Huntington's disease is and can get tricky. And so if you are feeling compressed to make promises like that, where potentially you are going to have to ask for help or get help, it's going to really impact upon your grieving, because you haven't kept that promise. So if you're having these conversations now with people that you love, you really need to be honest and say, look, I can't promise you that, because it's going to get tricky, and get that honesty out now. And then you have an opportunity, they're probably going to be angry with you, but you can have an opportunity to get to a better place where you can be honest and say, I can't promise you that. I can't promise you that. You might need more complicated care than I can give you. So be honest. And then perhaps they can have an opportunity to make some choices for themselves. Okay, then I've got to go into a nursing home if it ever comes to it. Let's hope it doesn't. I'd like to be by the sea. I'd like to be in the country. I'd like to be near my parents. So there are ways that it can be better managed than no, and then you having to put yourself in a position where you are betraying, or you will feel like you are betraying their faith in you, and you don't want to risk that. So be honest. Have these conversations is the point I'm making. Get your advanced care plans in early. Has anybody talked about brain donation? Because that's a wonderful thing, and I've had quite a few of my patients who have signed up to donate their brain, but you have to have your paperwork in order, so it has to be discussed early. And now, with all the research that's going on, to donate your brain is a wonderful thing that you can do. A wonderful thing that your loved one can do to give your disease some purpose, that you can share the knowledge of what they may discover with the use of your brain as donation. But these things need to be discussed, and they need to be put into paper, down on paper, and that all needs to be put in place. And I think the Huntington's Disease Association are able to direct you to brain donation if that's what you want to do. Power of attorney is the last thing I will say on this matter. Power of attorney needs to get in place. You can have power of attorney for health and well-being, and power of attorney for finances. And I've got power of attorney for my dad, although he's still able to make all his decisions. But if it ever comes to it, then I can make them for him, and there will be no problem with that. You just need to get those things set up early, so that there isn't any argument, because if it gets to a point where your loved one or you cannot communicate your wishes about removal of PEG or about anything, you are going to have to show capacity. And unfortunately, showing capacity is a lot about communication. So unless you have written it down somewhere, no one's going to know it, and you're not going to get considered. So power of attorney, advanced care plans, get them done, and then you're going to feel so much more empowered and much more confident of the way your life trajectory is going to go. Oh, right. When I lost my mum 6 years ago, it was a shocker. She was a bit off colour, and she was, we went to see the doctor, and they did a few blood tests, and she had to go for a bone marrow test. And then we were called back in for the results the following day, actually. And then she went to hospital on the Saturday because she was feeling a bit poorly. And then she died the following Wednesday. Bang. And it was crazy. We were not prepared for it. We had no advanced care plans in place, that's for sure. However, I was so fortunate to have lived with my mum for many years before she died. 10 years we all lived together. So we'd had lots of conversations, about what happens when you die, Mum, or, if I die. And a lot of them were very humorous. For example, one I said, Mum, when you die, I'm going to get you stuffed so the cat will have somewhere to sit, because the cat was always on her lap. She replied, oh, yeah, okay. Or you could put me in the window like Norman Bates's mother. And we did laugh about that. And I often think about that one too. The point is, when it came to it, and when we were in hospital, even with all the shock that was going on, and when we decided not to proceed with any more treatment, not to give her another blood transfusion, to stop the high pressure oxygen that she was wearing so we could have a conversation, not to restart her heart if it stopped, I knew that this was what she wanted, because we'd had many lengthy, honest conversations. We're both nurses and we both had gallows humour, so we were able to be quite honest and open about what she believed was going to happen to her and what she wanted if anything went wrong. And we talked all the time. Drove my dad mad, but we talked. So there was a time when I thought that losing my mother would be the worst thing ever in my life. And it was, without a shadow of a doubt. However, I'm okay. Life is okay. Life's good, actually. And grief visits me. But with the grief comes these conversations that we had, these funny moments, these funny memories. Because we shared so much and talked so much. There's one time she went to the petrol station to have a car wash. And she got out and put the code in and got back in the car and drove in and got her wheel stuck and forgot to shut the window. So when she came home, half of her was entirely soaked, hair plastered to her head, makeup all down the one side of her face, like the Phantom of the Opera. It was so funny, and I cannot think about my mum now without that memory. She was furious and yet hilarious at the same time, and I can't think of it. So there is a beauty and a sadness in all of it, and the conversations and the memories have to be there for you to feel that joy in grief, if that's the right phrase, really. I know what Mum believed and what she wanted, and so I'm okay with it all because we talked, and that's the point I'm making here. Talk, get things down, understand what the person wants and know it, because it makes such a difference to grief at the end. So we'll move on into loss, bereavement, grief and mourning. So loss is a change, a transition between changes. We're experiencing some kind of deprivation. Now, there's a lot of research to say that we're all experts at loss, because we've all experienced loss at some point in our lives. We may have lost a grandparent or a parent, or we may have lost a pet. We may have left home, or our kids have left home, or we might have not got a job, or we've split up from a relationship that we really loved someone. These are all losses, and we are all experienced at that. And it's associated, as I said here, with a change from one situation that we thought was all lovely to one that is no longer quite as comfortable, and we've lost something. Bereavement is where you've sustained the loss. This has happened. It's an emotional suffering state. It's a feeling of pain and numbness and panic, and it's very visceral. Your nerves are jangling, and every noise makes you jump. It's exhausting, and it can last for 1 week up to many, many months. Okay, it's an emotional suffering state. You can't get your head together. People ask you things and you've forgotten about it. You walk into the kitchen and you don't know what you're doing there. You walk out again. You cannot get your head together because you're physically invested in this emotion. Grief is a roller coaster. There's more thought involved. So you're conscious and unconsciously thinking. You're going back to that first and last moment. You're going on that deathbed scene. You're going down that road every day. You're happy 1 minute and you're sad and you're yearning. I remember going to see the doctor when Mum died, just to say, did we miss anything? Could I have done anything? I'm a nurse. How did I not notice this? You're yearning and you're searching for answers. There's a preoccupation with past places where you lived, or where you used to go and eat or drink, or you hang out. You're listening. You're playing records all the time, or watching programs. I still watch Tipping Point nearly every day, which I watch them. These are you're looking for connection to people and to places that give you that moment of comfort. And then mourning. And mourning is where you're letting go. You're reorganizing yourself, you're rebuilding, and you're establishing a new purpose. And these are the way what you will pass through that period. Here is a nice little visual of grief, and I like this actually because when you're in it, it's helpful to kind of go, oh gosh, yes, here I am, in this period. So there we are at the top left there in the river of life, in our little boat. And some of us, certainly with HD, that river is would have been fairly rocky already. We'd have come along through life on a fairly challenging journey, and some of us may have just loved the ride. It might have been fantastic, and then the death occurs, and you're going to go over those waterfalls, and there's going to be shock and numbness and denial and this emotion of free falling days and days. You just get up and you're moving through it with no direction other than down. And then you're going to land into the whirlpool of grief. And here is where you've got the grief. You've got all kinds of emotions going on. You're swaying around in there. And sometimes you're going to wash up on the shore, and you're going to feel washed up and knackered and exhausted, and you can't think about anything. You're just going to lie there gasping like a fish on the beach. And then you get back into the whirlpool and you're thrown around again for a while. You're going to hit the rocks on the other side. It's painful and you're aching all over, and you wonder what's going on, and oh God, it's just a physical, visceral experience in that whirlpool. But eventually you're going to reach a point of acceptance, and something's going to come by that you're going to catch hold of, and it's going to keep you afloat and bring you out of the whirlpool and help you find your boat and regain your oars and get someone in to help you, some more crew members, and get you back on, reorganized back into investing in life again and moving along that river in a more comfortable way. So to navigate this river of life, which we are all on, regardless of illness or who we've got in our lives, well or unwell, and to get us through the waterfall and out the other side as safely as we can, it makes sense for us to get ready, because it's going to come. We know, take HD out of the mixture. We're all going to have adversity at some point in our lives. So we need to develop our resilience. We need to become resilient. And resilience is a capability to withstand adversity. It's a way that in the past we've got over it. We've got over the split up from the boyfriend or the loss of our dog or cat. And these may be glib examples I'm giving here, but it's the same thing. It's a way that we've got over something that's challenged us in the past. And it's an opportunity to recover and to grow. And there are lots of ways of talking about resilience, and there's lots of resilience training out there. But what I'm going to use just as examples for today are self-awareness, mindfulness, self-care, positive relationships, and purpose. And if you have these or you consider these areas now, today, moving forward, as your resilience toolkit, if you pay attention to those areas, it will make it easier for you to cope. I can't change what's going to happen. None of us can change what's going to happen or what's going to come, or we can't see what's going to come, but we can deal with these things. These are things within our own control. Self-awareness is about you, who you are, and your spirituality. Again, it's not about religion. Spirituality is about morals, about meaning, about your belief in your moral fibre. What is true to you? What is good? And what makes us human? I'm reading currently the Little Book of Philosophy, and the ancient philosophers were doing all this as the same as we're doing today, just trying to make sense of the world and trying to find meaning in what's going on around us. So who are you? Explore that and understand it for yourself. Mindfulness is something you might have heard about, and it's about being present in the situation. So if you can be truly mindful, then you have no regrets. You think, I wish I hadn't done that. I wish I was back there. I wish things hadn't changed. And you have no fear for the future because you can't control that either. Now, I know if you're looking after someone with HD, that's hard. Okay. So, but there are ways to kind of nudge you into just trying to live in the moment. Okay. So journaling is a really good thing. Now, that's not about writing a diary and like Samuel Pepys or Adrian Mole. It's about journaling is about word vomit, for better word. It's writing down what's in your head so that it isn't sitting in your head and making you angry or frustrated or anxious. So it's writing down, I'm fed up today. I wish that everyone would just leave me alone. Or the other day I wrote, I did my hair really nice and no one noticed. They're all a load of selfish ingrates who don't care about me. I walked around self-righteously with my nice hairdo. But if I'd have kept it in my head, I wouldn't have noticed the nice things that they were saying to me. And the other stuff that was going on, the nice things that were going on in my life, I would have just been there with my lovely hair being angry. So journaling is about writing down your thoughts and feelings. You can write as much as you want. You can write as little as you want. Some days I just write, ugh, or I'm tired. But writing it down helps to get it out of your head. Can you see what I'm saying? Otherwise we're just chattering and ruminating, and that breeds anxiety and frustration. Meditation is, it's sometimes something that may be difficult for you to do, but just sitting in the garden for a little bit, listening to the birds is a way of meditating. It's calming your mind down. There's lots of lovely free meditations on YouTube, or you can get apps on your phone, or there's certainly, I think Ruth said that there's one on the HD website, actually, a meditation for anyone who would like to try it. Find a moment just to still your mind, because that can really help your mental health and help you stay positive. Okay. Gratitude. If you Google or go onto Amazon and put mindfulness journaling, there are lots of little books out there that just nudge you into a more positive frame of mind. And the one I use is 6 Minute Diary, or there's lots actually. Mindfulness, there's some that are sweary. You can write all your swear words in if you want. There's lots of ways. And what it does, it just says today, what you're going to do today and how you're going to do it. And what's been good about today and what you're going to do tomorrow to make it better. And it's just a little nudge to nudge you into a more positive frame of mind when we're struggling. Okay? Self-care, this is pretty self-explanatory. Are you eating? Hydrating, drinking well enough, exercising, and again, that's hard sometimes if you're caring for somebody, but there are ways. You can have a dance in the kitchen with a nice song on the radio, or there's lots of exercise on YouTube, or you can just get out for a walk in the countryside. But exercising does release these positive hormones, and so if you're uptight and you're feeling anxious and stressed, doing something to break that can just really, really help. Are you sleeping okay? And how are you treating yourself? What treats are you having? Are you having a face pack, a nice bubble bath? You're getting a chance to have a massage, or whatever it is that makes you happy. Are you doing that, or are you denying it because of the responsibility that you have elsewhere? Because if you don't look after yourself, who is going to look after the person if you were to go under with the stress of it? There's a famous thing that they say, which is, there's a reason why in an airplane, when the oxygen comes down, they say, put the adult, put it on first and then the children, because if you don't look after yourself first, you're not going to be able to look after your kids. You're not going to be able to look after the person you love if you don't care for yourself first. Positive relationships. Who can you turn to? Who have you got to talk to? How are you maintaining your friendships? And then sometimes, you know, when you're struggling, friendships can fall away, and I get that. So who can you speak to if you can maintain your friendships? Because friends want to help in hard times, but they don't know what to say. And I certainly hang out with my friends, and often I don't say anything when I'm feeling sad or angry. We just sit there. So sometimes if you have to reach out, because friends want to help you, but they don't know what to say. But there are other ways to be friends. There's certainly the HDA, or there are lots of forums online, and there are ways that you can share the load. A friend of mine, her husband has Alzheimer's, and quite often she rings the Samaritans just to have a chat, just to offload her thoughts, because it's about sharing and contact and community. If you're feeling alone, it can be really, really hard. I put counselling in there. I personally go and see a counsellor every now and again for my own mental health. I would quite happily pay her so I can go moan about my family without having to moan about them, because they just get upset. And it's just a way of talking about what's important to me, because counsellors don't need to know about your life, about HD. They don't need to know about anything. They're there for you to talk about how you are feeling. I'm sad, I'm angry, I'm frustrated, I'm resentful. All of that is normal, and all of that is okay. But find someone. The GP could probably set you up. Certainly, if you're looking after someone with a terminal illness, can set you up with counselling. And I know the hospice, because I do it, have volunteer counsellors who will be there to listen to you. So there are ways for you to get support. You need to reach out for that. And then the last one is purpose. Purpose is, what do you want? Where are you going, and how are you going to get there? And again, you know, I'm very respectful of the fact that some of you might be looking after somebody, and it might be quite challenging. In which case, the question would be, what do you want? You want to sleep better. You want to feel better about yourself. You want to feel less stressed. Look to this toolkit. Look to these, something within here that you can try one little thing and see if it helps to make you unravel a little bit and give you a little bit more strength to navigate what's coming. Because we all need that. We all need a bit of strength. And if you can continue to focus on these things that matter, that make you stronger, then you will have a better outcome for yourself. I'm sharing just some of the websites that I've talked about within this group now. Soul Companions, that's the doula group that I'm in, and on there is advice about doulas, and you can reach out to them if you're interested. My details aren't on there actually, because I keep forgetting to send my stuff over to Jane, who's the leader, and I'm sure she's fed up with me about that. But my colleagues, my lovely friends Sabrina and Ali are on there, and so if you have any questions about doula work, I'm sure if you reach out to them, they'll gladly help you. Answer any of your questions. Dying Matters, it was Dying Matters week last week actually, and that's a great website, got lots of resources and signposting for anyone who has any questions about it. Sacred Dying is the link that I shared about the rituals, and it's a lovely little website. It's American, and it's a website about rituals and alternative ways to support people that are dying. The Conversation Project, I'll just put that up. I think it's American, but it's talking about death, and it's a project that's going on in America. So I just thought I'd be interested if anyone needs some help in starting those conversations. Then that's a little thing to look at. And that's a PDF at the bottom there, which is that picture that I showed about rituals, and there's some more information on there about that. So there you have it. I will stop sharing and have a little word. I can't stop the loss. We can't stop the trajectory. We cannot do anything about that or the way it's going. But you can, you know, every day, all of us can wake up every day and hope for a breakthrough in the research for HD, which, you know, we're all really hoping for. But as I said before, hoping for the best and planning for the worst is really all that we can do. I started by saying that we don't talk enough about death. And I suspect now with COVID, we're all thinking about it. We're thinking about it every day and all the time. So why not talk about it? Why not share your thoughts with your family and friends, and get some ways to feel more resilient about what's going on around us? Well, and whilst we're all talking about death and worrying about death and thinking about death and talking to your family about death, don't forget to live, because that's really the best bit.